Hello, my name is Dr. Chris Kolker, and this is ChristianWebMD. The topic that we have at hand right now is low back pain and the evaluation of low back pain. Low back pain now is the most common cause that people go to the doctor for a chronic, long-term medical condition. It's rampant, and it seems to only be getting worse. Personally, I see scores of patients with low back pain, and at times can be a very frustrating disorder to treat. It seems that we do the right things, and oftentimes people don't get better. We'll go over the evaluation in this video and some of the treatment options in the next video. Oftentimes people want an MRI right away, and sometimes I simply have to say no. And people wonder why. And I tell them that fortunately, most of the time, in most people, low back pain gets better on its own. The body does have a remarkable ability to heal. And I tell people if they had a low back pain only for a couple of days, expensive tests, and even x-rays may simply not be indicated. That's a little bit different if there are things what we call red flag symptoms. If the person's urinating on themselves, if the crotch area is completely numb, if they simply can't move at all, and they can't walk, and they can't do the things that they've done, those are some red flags that indicate to me that perhaps they need aggressive evaluation. A final one would be if they defecate on themselves. That obviously is a very scary proposition and fundamentally means that there's something going wrong. Fortunately, the vast majority of people don't have symptoms such as these. Oftentimes, conservative treatment will be done first. If that doesn't work, sometimes we do go back and get an x-ray before sending the patient to physical therapy. MRIs, of course, can be done and often are, but sometimes they're a little bit too good. They point out problems that are not significant. But if they point out some problems that are not significant, sometimes it clouds the picture. And it makes it difficult for us to understand exactly what we're treating. Occasionally, something called a CT myelogram can be done that uses a CT as well as a shot in the back to better look at the disc in the back. Fortunately, that doesn't have to be done too often. Finally, if we think that the back pain is causing profound muscle weakness or nerve dysfunction, we can do a study called a nerve conduction study and electromyogram. This is usually done by a neurologist who look at the function and the relative strength of the muscle. If there's some compromise there, that might indicate that the back injury is more serious than we would like to see. If you have questions about low back pain or the evaluation of low back pain, please consult with your physician. Remember, this video is for educational use only. It's not meant to diagnose or treat any disease. Again, please consult with your physician with any questions, and thank you for watching ChristianWebMD.